Hi, this video is to help you take care of yourself at home after your lung surgery. The information in this video is an overview. You will receive specific instructions from your healthcare team. If you have questions or concerns about the information, or if these instructions are different in any way with the other information you've received, please talk to your nurse. You've had major surgery. Your body will need time to heal. You may feel tired for 6 to 8 weeks after your surgery. It is important that you follow the activity instructions. Continue to exercise. Walk 4 or more times per day. You may walk up and down the stairs. Walk to the point of being mildly tired, but not to the point of complete exhaustion. It is better to get up a few times every day rather than getting very tired one day than resting all day the next day. Continue your breathing and coughing exercises. Use your incentive spirometer 10 times every hour during the day. Continue these exercises for 4 to 6 weeks or until your next follow-up appointment. Do not lift anything more than 10 pounds for 4 to 6 weeks. Avoid strenuous activities that may overstretch your arm or shoulder muscles. This includes swimming, tennis, golf, or vacuuming. Do not drive until you are off narcotic pain medicines. Do not drink alcohol while you are taking pain medicine. Do not smoke or expose yourself to smoke. If you had a thoracotomy, begin arm exercises after lung surgery as shown on the handout. Do these daily. This will help to loosen the tight muscles and get your arm moving again. Begin slowly and increase the amount until you are at a comfortable level. In about 6 to 8 weeks, you should be able to use your arm and shoulder as you did before surgery. If you had a VATS procedure, you may begin with more intense exercise 2 weeks after discharge. You may lift 20 pounds and increase to 40 pounds as tolerated. Full healing will still take 6 to 8 weeks. It is important that you stay active. This prevents pneumonia and will help your body heal. Before you go home, you will be given supplies to change your dressing and any additional supplies you may need. If you're currently getting oxygen, we will work to remove the oxygen before you are discharged. However, if you still require oxygen at home, the respiratory therapist will perform an evaluation. If you qualify, your case manager will make arrangements for home oxygen. If you have questions about the supplies, ask your nurse before you are discharged. Proper care to your surgical site is important. There will be small strips similar to tape across your incision. Keep these strips on your incision until they become loose. Wash over the strips to clean the incision area. Wash daily with antibacterial soap and water. Look for redness, swelling, or foul-smelling drainage from your incision. These may be signs of an infection. When the strips become loose, you can take them off. If they're still on after 10 days, remove them. You will need to clean and monitor your chest tube site as well. Leave the chest tube dressing in place for 48 hours after the chest tube has been removed. After 48 hours, remove the chest tube dressing. Wash the site with antibacterial soap and water daily. Look for redness, swelling, or foul-smelling drainage from your incision. Again, these may be signs of infection. It is normal to have drainage from the chest tube site until the incision is healed. If the chest tube site is still draining fluid, apply clean gauze and tape. If the chest tube site is no longer draining, you may leave it open to air and can shower. You may take a warm bath 4 to 6 weeks after you are home. Your nurse will give you a list of medicines before you're discharged. The nurse will review each medicine with you. Be sure to take your pain medicine regularly. Don't wait until you feel too uncomfortable. It helps to stay ahead of the pain. If you fall behind and your pain level increases, it can take longer to regain good pain control. It may be helpful to set an alarm clock. This will wake you at night to take your pain medicine. You may feel discomfort for 1 to 2 months. Your skin may feel numb or sensitive, especially near your incision or nipple area. However, your pain should lessen over time. During surgery, you may have gotten a long-acting pain medicine. This medicine will stay in your system for 3 or more days. As it wears off, you may be more uncomfortable. Don't be alarmed. You will have additional pain management options. Tell your doctor if you have a new pain or increased intensity in pain. Plan ahead. Be sure to call the thoracic center before you run out of pain medicine. Take your pain medicines with food to avoid nausea. Do not drink alcohol or drive while on pain medicine. Do not stop your medicines abruptly. You will be given instructions on how to safely reduce your pain medicine. Weaning pain medicines is an individual process. As your pain decreases, you can space your doses further apart. Call the thoracic center if you have any questions. If your prescription is not covered by insurance or is too expensive, again, call the thoracic center. It is normal to have a decreased appetite after surgery. If you're not on a special diet, you may eat or drink without restrictions. Eat small, frequent meals and use supplements such as Ensure or Boost. Drink plenty of fluids. Pain medicines can cause constipation. You will be given a prescription for Senna S, which is a stool softener. Take 2 tablets orally twice a day to prevent constipation while on pain medicines. If you still have constipation while taking Senna S, take an over-the-counter laxative such as Miralax, milk of magnesia, Bisacodyl, or Fleet's enema. Drink a full glass of water if you take fiber supplements. Stop taking stool softeners and laxatives if you develop diarrhea. Eat a high-fiber diet. Include food and drinks like figs and prune juice. Drinking plenty of fluids and staying active helps to prevent constipation. Follow-up appointments are usually scheduled for 1 month and then again 6 months after surgery. Each time you may have a chest x-ray. Contact the thoracic center if you have pain not controlled with medicine. You develop a new or worsening cough. You have constipation that does not improve with over-the-counter laxatives. You have persistent nausea, vomiting, or diarrhea, or to receive pathology results. Call 911 or go to the nearest emergency center if you have increased difficulty breathing, fever greater than 101 degrees Fahrenheit, worsening redness, swelling, or drainage from your incisions, or foul-smelling drainage from your incision. These are listed in your discharge handout. Feel free to watch this video again through My MD Anderson. Remember, your healthcare team is always here if you have any questions.